Hello, dear learners. Welcome to Exploring and Understanding of How Research Supports Yoga for Mental Health. Let's set forth on a journey of exploration, gently weaving the threads of research into the fabric of our own knowledge and skills. So, whether you're a therapist, teacher, or simply a seeker of knowledge, I invite you to embrace these moments with a sense of gentle curiosity and openness. I'm your host, Judy Thompson, and in today's segment, we will be exploring the publication, A Randomized Controlled Trial on Pranayama and Yoga Nidra for Anxiety and Depression in Patients with Cervical Cancer, Undergoing Standard of Care, published March 2024 in the journal Cureus, Journal of Medical Science. Authored by F.J. Nuzad, N.J. Patil, S.R. Sheila, and G.N. Manjunath. Today's episode examines a study on the benefits of Yoga Nidra and Pranayama as complementary therapies for mental effects post-cervical cancer treatments. These yoga branches, known for relaxation and breath control, may offer significant influence on anxiety and depression. We will examine the nature of cervical cancer, the psychological toll it creates in patients, and how specific yogic practices could help revolutionize the recovery process by bridging the gap between traditional care and holistic therapy. According to the World Health Organization and the American Cancer Society, there is a 20.2% chance that a person will develop cancer by age 74. In 2018, over 500,000 new cervical cancer cases and more than 300,000 deaths occurred globally. Although screening programs have decreased the number and severity of cases, cervical cancer remains a major issue. Cervical cancer patients may encounter various symptoms, such as abnormal bleeding, abnormal discharge and abdominal pain, pelvic pain, swelling in the legs, dull backache, painful urination, and painful bowel movements. The diagnosis is confirmed through a colposcopy followed by biopsy. Although the physical symptoms are significant, women diagnosed with cervical cancer frequently deal with psychological symptoms as well, including intense depression, sadness, anxiety, fear, and worry. Additionally, the societal stigma linked to cervical cancer, often due to the human papillomavirus, HPV, can result in harmful stereotypes and false assumptions about a patient's sexual history. The combination of social stigma and the personal battle against a serious illness can intensify emotional distress, increasing depression and anxiety levels. The mental toll of the diagnosis is often exacerbated with the cancer treatments, which may include surgery, chemotherapy, and radiotherapy. These come with significant side effects, from urinary issues to sexual dysfunction, and can heavily affect the quality of life. The ongoing stress of cancer further elevates emotional and psychological difficulties, which can hinder the recovery process. Offering resources to help address depression and anxiety alongside medical cancer treatment can help support a patient's path to recover and also instill a sense of strength, perseverance, and hope. And this is where we examine the complementary approaches of Yoga Nidra and Pranayama. Yoga Nidra and Pranayama stem from ancient Indian traditions, focusing on overall wellness. Yoga Nidra, or yogic sleep, involves meditative guidance through the 5 layers of self, from the physical body to the deepest parts of the subconscious, achieving a state between wakefulness and sleep that utilizes deep rest for healing. Pranayama signifies breath regulation. Prana stands for essential life energy, and ayama denotes controlling or extending. Pranayama involves managing the life force with regulated breaths to enhance energy circulation within the body. Each patterned breath fosters a link between bodily reactions and mental reaction, bridging a balance between the two that is often lacking. Pranayama can be therapeutic, especially for cervical cancer patients who face severe stress after diagnosis and treatment. The holistic nature of Yoga Nidra aids in balancing emotional dysregulation. It introduces a calming influence on the nervous system, disarming the stress response. Through relaxation and visualization, Yoga Nidra brings healing, helping to reduce depression and anxiety symptoms. Pranayama's breathing patterns oxygenate the body and calm the mind. This breath flow can mitigate anxiety's effects, re-establishing control. The inhalations and exhalations ignite the parasympathetic system, inducing a repose state. In cancer care, Yoga Nidra and Pranayama are promising non-pharmacological ways to bring ease to the nervous system. Studies are beginning to highlight how these holistic approaches can help bring healing to the body beyond pharmacologics, drugs, and surgeries. When examining the link between traditional practices and medical treatments, rigorous studies are essential. The focus of this research study was in assessing the effectiveness of Yoga Nidra and Pranayama to help reduce psychological distress in cervical cancer patients. The study's methodology, structured as a randomized controlled trial, is considered the most reliable method in clinical research for generating definite results. The study lasted 2 years, which was long enough to detect possible patterns and outcomes related to the treatments. Criteria for patient selection included patients with histologically confirmed cervical cancer in stages 1 through 4, aged 35 to 80 years. Key exclusion criteria kept out patients with HIV, musculoskeletal disorders, or those who had major surgery in the previous 4 months, thus reducing confusing variables and ensuring that results were more likely due to the treatments. Sample size determination is a vital aspect to confirm the study's ability to identify a significant effect. Each group needed 35 patients, predicting a 10% dropout rate. 70 participants were randomized into 2 groups, a control arm and an experimental arm. This study introduces the adjunct therapies of Yoga Nidra and Pranayama, tailored specifically for individuals undergoing strenuous medical treatments and to support emotional and psychological distress. The yoga intervention followed a structured program, with each session lasting for 30 minutes, conducted twice daily, and spanned over a period of 6 weeks. The integrated yoga module features 3 main practices, which included breathing exercises, including hands in and out breathing and hand stretch breathing, pranayama techniques such as alternate nostril breathing and Brahmari pranayama, which resembles a bee's sound, and also 3-part breath pranayama. Following pranayama, Yoga Nidra meditation was offered. Each yoga intervention was delivered by a seasoned yoga professional to ensure that patients could comfortably engage in the exercises, regardless of their physical condition. The practices were adapted to meet the needs of each recipient, affording a personalized sense of care additional to their medical treatment. In the field of scientific research, various tools are used to measure patient outcomes. This study used the Hospital Anxiety and Depression Scale, HADS, to assess patient anxiety and depression levels. HADS is a proven tool that accurately determines the presence and severity of these conditions. It comprises 14 questions that explore different facets of anxiety and depression. HADS is considered a straightforward approach with the ability to tell apart the physical symptoms of an illness from the mental symptoms of distress. This distinction is important as it helps healthcare professionals understand the level of mental health issues a patient has, apart from any physical health problems. The HADS questionnaire serves a pivotal role. Before the introduction of the yoga intervention and at regular intervals during the study, specifically at the 2nd, 4th, and 6th weeks, the HADS was administered to capture the dynamic changes in the patient's mental health status. By repeating the HADS assessment at specified intervals and analyzing the data through the described statistical methods, the research team could observe not only the presence of anxiety and depression, but also track any trends in improvement or deterioration over time. These measurements provided a clear view of the impact of yoga interventions on the mental health of patients undergoing treatment for cervical cancer, hence fulfilling a pivotal aspect of the study's aims. The data from the study reveals the benefits of integrating yoga into medical care for these patients. The study began with the experimental yoga group and the control group's baseline scores, showing no significant difference. This allowed for analysis of the intervention's impact. As the weeks passed, a pattern emerged, highlighting differences between the groups. The control group, sticking to standard care, saw an unexpected rise in depression and anxiety from week 0 to week 6, indicating ongoing mental health challenges with conventional treatment alone. The experimental group, which received the tailored yoga intervention alongside standard care, reflected a noticeable change in the depression and anxiety scores. Yoga Nidra and Pranayama sessions led to a significant improvement, highlighting differences from the control group's experience. The data shows that yoga didn't just prevent mental distress from getting worse, it reduced it. Over time, the yoga group's mental state improved from borderline abnormal to normal on the hospital anxiety and depression scale, indicating a more calm inner state. It's critical to note the yoga practices were not only effective, but also universally adhered to, with sessions at 100% compliance. This adherence underscores the feasibility of these practices among patients. Let's now take a quantitative view. The control group's depression scores fluctuated, peaking during treatment, reflecting the emotional toll of cancer management. For anxiety, similar patterns emerged, with scores rising as treatment progressed. By week 6, depression and anxiety scores showed a notable difference in favor of the experimental group. This data highlights not just the reduction of negative emotions, but also the promotion of psychological wellness, an effect that can be as important as treating the physical ailment. In our exploration, we've noted how mind-body therapies like Yoga Nidra and Pranayama can shift the well-being of those with cervical cancer. These therapies not only improve physical health, but also enhance mental health. Statistical evidence shows that patients practicing yoga alongside standard care exhibited a significant drop in depression and anxiety after 6 weeks, unlike the control group. Yoga Nidra may help lead to a deep state of relaxation, crucial for reducing stress and promoting calm. And Pranayama, with its breathing techniques, may help reduce physiological stress responses and enhance a sense of calmness and focus. The study confirms that traditional practices have a role in modern medical care, particularly as supplementary treatments. Including these methods in treatment regimens has the potential to improve not just the physical symptoms of cervical cancer, but can also help support the mental challenges. The psychological advantages observed in the study suggest that healthcare providers and policymakers must increasingly begin to recognize the importance of providing a more holistic, patient-centered approach to effective care. Due to their ease of use, flexibility, and non-invasive character, these practices can be adapted and modified to meet the needs of many abilities, including those with disabilities. Considering the broader implications of these findings, we can see that yoga could be a cost-effective supplement to medical treatments. By possibly reducing the need for drug-based mental health treatments, these practices could be an economically sensible and patient-friendly addition to cancer therapy. The study we've examined today shows promising signs that adding Yoga Nidra and Pranayama to standard patient care for those with cervical cancer is beneficial. The results clearly show the significant role these practices have in coping with both the physical effects of cancer treatment and psychological stress. The structured yoga program given to the experimental group led to decreases in anxiety and depression levels, unlike the control group. This confirms that these practices could enhance traditional treatment plans, improving psychological care for patients. Yet the importance of further studies, which may include a larger sample size, is important to continue validating the role of yoga-based practices as complementary and holistic approaches of care. Future studies may also include more diverse populations to enhance the generalization of the results. As we conclude our episode, let's summarize the key points we've discussed today. We looked at cervical cancer, a disease that affects both the body and the mind, often causing anxiety and depression in patients. Our discussion highlighted the role of Yoga Nidra and Pranayama as helpful supplements to traditional treatment, providing hope for reducing the psychological effects of cancer therapies. The study we examined was thorough, carefully assessing how these practices benefit patients' mental health. The findings were positive. Patients experienced a significant boost in emotional well-being when they added Yoga Nidra and Pranayama to their treatment plan. This underscores the effectiveness of combining traditional and modern medicine and the need to address mental health in chronic physical disease management. In your own time, I encourage you to reflect on today's discussion and consider how the combining traditional and modern medicine may benefit not only patients with cervical cancer, but anyone seeking holistic well-being. Thank you to the authors and publisher for all of the research into this important study, a randomized controlled trial on Pranayama and Yoga Nidra for anxiety and depression in patients with cervical cancer undergoing standard of care. For those eager to continue exploring or for anyone seeking more in-depth information, additional resources and supplementary materials can be accessed within the links provided in the episode description. As we end our time together, remember to embrace and witness the beauty of life, and within shared experience, be the thread that creates compassion and curiosity for others. Thank you for joining me on this journey in learning how research supports yoga and integrative practices for mental health and well-being. May you find and share beauty and peace on your journey toward wellness.